Good evening everyone. Today I will discuss with you a case of keratoconus. A young male 25-year-old, he presented to our OPD with complaint of frequent change in glasses. He is a myope, and when we have done the keratometry of the patient, the keratometric readings are high. Like normally the keratometric readings are 44-45 diopter, but here we are seeing that the keratometric readings are 49 diopter, 50 diopter. And when we have asked the patient to look down, we have seen a V-shaped deformity of the lower eyelid. That is a Munson sign positive which is seen in patients of keratoconus. Also, when we have seen the patient on slit lamp, we have seen some vertical striations in the cornea of patient. This is the cropped image of the cornea of patient, and you are seeing the vertical striations on the cornea. These are the box stria which are seen in case of keratoconus. When we have done the 9-point pachymetry, basically the topographic machines are not available at our institute, so we have done the pachymetry of the patient to see the corneal thickness at the various points on the cornea. So we have done the 9-point pachymetry of the patient, which is usually done in cases of keratoconus, and we have seen these are the 9 points which we have seen. And in this central corneal thickness, you are seeing that it is 450, 461, matlab it is comparatively thin. So we are suspecting it to be a case of keratoconus. What is keratoconus? Keratoconus 9-point pachymetry means that at 9 points you are measuring the corneal thickness. If it is keratoconus, the cornea will be thinned at places where it is protruding in the form of a cone. So here the central cornea is protruding, which is an unusual case. Generally there is axial thinning which occurs, but here the central thinning of cornea is occurring. So by all the findings, we are suspecting the patient to be a case of keratoconus. What is keratoconus? It is an ectatic disorder of cornea where progressive corneal thinning occurs. What is the pathogenesis? The exact pathogenesis of keratoconus is not very clear, but it is linked to some defective production of mucopolysaccharide and collagen. Collagen are an important component of the structure of cornea. I have already told you in the anatomy of cornea. You can see that video on anatomy of cornea, that collagen is forming an important part of structure of cornea. So if it is defective, then the cornea will not be that normal. So the thinning of cornea will occur. It starts at puberty, then it will progress slowly. Important is that it is a non-inflammatory condition. Other ectatic disorder of cornea are keratoglobus, pellucid marginal degeneration, Terrien's marginal degeneration, and one more, that is keratoconus posterior. What are the clinical features of patient? The patient will present to you with defective vision, और patient complain करेगा frequent change of glasses का. तो आप suspect करेंगे कि कहीं इसको keratoconus तो नहीं. फिर आप उसकी keratometric readings कराएंगे तो आपको keratometric readings उसकी बहुत ज़्यादा हाई मिलेंगी keratometer पे. नॉर्मली 44-45 होती हैं, आपको ज़्यादा मिलेंगी, लाइक मोर देन 48 डायप्टर्स रीडिंग आपको मिलेंगी. एंड प्रोग्रेसिव मायोपिया, इरेगुलर एस्टिग्मेटिज्म विल बी सीन. And when you will do the placido disc examination, what is a placido disc? A placido disc is basically to see the curvature of cornea, to see the surface of cornea. Topography is to see the surface of cornea. So we are doing that placido disc examination. It is having some black and white rings, and in center there is a hole. You are seeing the reflection from the corneal surface. If the rings are like equally placed, then the corneal surface, the curvature of cornea is normal. But if there is some deformity or distortion of those circles, irregularity of circles, then definitely the corneal surface is irregular. When you will do the slit lamp examination, what are the signs you will see on slit lamp in case of a keratoconus? The cornea will thin out. Cornea thin होते जा रही है तो क्या क्या होगा? Cornea stretch होएगी तो स्ट्राया हो जाएंगे. बेसिकली वर्टिकल स्ट्राया इसमें मिलते हैं. जब कंजेनाइटल ग्लूकोमा है उसमें हॉरिजॉन्टल स्ट्राया मिलते हैं, इसमें वर्टिकल स्ट्राया मिलते हैं. एंड कॉर्निया थिन होते जा रही है तो क्या होता है? कॉर्नियल नर्व्स भी प्रोमिनेंट हो जाती हैं. कॉर्नियल प्रोमिनेंट नर्व्स आर सीन इन दिस केस. एंड ऑल्सो दोज नर्व्स आर नॉट basically thick nerves. Thick nerves are seen in like leprosy patient. These are due to thinning of the cornea. Those nerves are seen. And Fleischer ring. Fleischer ring क्या होता है? कॉर्निया में जहाँ भी कहीं आपका टीयर फिल्म का स्टेसिस होगा वहाँ पे आयरन डिपोजिशन हो सकता है जिसकी वजह से रिंग बन जाती हैं. तो जो केरेटोकोनस वाले पेशेंट में बनती हैं, दीज आर द फ्लेशर रिंग्स. और भी केसेस हैं जिसमें आपको कॉर्निया में आयरन डिपोजिशन की वजह से रिंग्स मिलती हैं. तो वो है आपके टेरिजियम. टेरिजियम में स्टेसिस ऑफ टीयर की वजह से जो कोन का एपिक्स होता है वहाँ पे आपको स्टॉकर लाइन मिलती है. हडसन स्टेली लाइन नॉर्मली विद एजिंग क्या होता है, जहाँ पे हमारी लोअर आईलिड रेस्ट कर रही होती है वहाँ पे स्टेसिस हो जाती है टीयर फिल्म की, तो एक लाइन मिलती है विच इज़ हर्ट्सन-स्टाइली लाइन, एंड फेरीज लाइन इज सीन इन केस ऑफ ट्रैब. दिस इज ऑल्सो सीन ड्यू टू स्टेसिस ऑफ टीयर फिल्म, आयरन डिपोजिशन इन ऑल दीज. और एक और रिंग है जो आपको याद रखनी है बाय द नेम ऑफ, बिकॉज यहाँ पे हम फ्लेशर रिंग याद रख रहे हैं केराटोकोनस में, तो एक क्लेशियर फ्लेशर रिंग होती है विच इज सीन इन केस ऑफ विल्सन डिजीज, जो कि पेरिफ्री में कॉपर डिपोजिशन की वजह से मिलती है. KF रिंग, यू हैव टू रिमेंबर इट ऑल्सो हेयर. और क्या चीज़ें होती हैं इसमें आपको, रेटिनोस्कोपी पे केराटोकोनस पे आते हैं हम. सीजरिंग रिफ्लेक्स, oil droplet reflex. One important thing from oil droplet you have to remember, oil droplet cataract, which is seen in case of galactosemia. Remember it here only. Munson sign, I have already told you, V-shaped deformity on looking down of lower lid. This is Munson sign positive. And then on keratometry high values, you can grade on keratoconus on the basis of keratometric readings like mild, moderate, severe, very severe, less than 48 diopters, 48 to 53 diopter, 53 to 55, or more than 55 diopter. You can do the corneal topography. You can see the thinned out areas of cornea in corneal topography. How will you morphologically classify the cornea? You will classify it as like nipple, oval, globus on the basis of shape of cone. Then what are the complications? These are the size, less than 5 mm, 5 to 6 mm, more than 6 mm. What are the complications of keratoconus? Acute hydrops. एक्यूट हाइड्रॉप्स में क्या होता है, आपका कॉर्निया थिन होते जा रहा है तो डेस्मेंट मेम्ब्रेन में ब्रेक आ जाएगा और सारा एक्वस एंटीरियर चैम्बर से सर्च करेगा कॉर्निया के अंदर. तो कॉर्निया में पेशेंट विल प्रेजेंट टू यू विद रेज्ड आईओपी, पेशेंट विल प्रेजेंट टू यू विद कॉर्नियल एडीमा, डिफेक्टिव विजन, पेन, फोटोफोबिया, लैक्राइमेशन, and you have to treat it accordingly. For corneal edema you have to give hypertonic saline drops. For inflammation you have to give anti-inflammatory, you have to give steroids, you have to give anti-glaucoma. नहीं होता है तो you can go for surgical measures like air injection. Suturing is done at site of deafened membrane brain. Full thickness corneal sutures are given, and if it is not relieved by all these conditions, ultimate option is you can do keratoplasty. The keratoconus is associated with some conditions. Some conditions are ocular, some are systemic. Ocular, like it is associated with ectopia lentis, congenital cataract, aniridia, retinitis pigmentosa, and vernal keratoconjunctivitis. In BKC patients, what happens? They frequently rub their eyes, so cornea get thinned out. And what are the systemic associations? Morphin syndrome. These are all collagen disorders. Osteogenesis imperfecta, Ehlers-Danlos syndrome. It is also associated with atopy, Down syndrome, mitral valve prolapse. Now what is the treatment of keratoconus? Early conditions में जब progressive myopia के साथ patient आ रहा है, धीरे धीरे progress कर रहा है, we will prescribe, पहले तो हम उसको spectacle देंगे in the early stages. Then हम उसको rigid gas permeable lenses देंगे. Soft lenses will not be able to form the shape of cornea, so we will prescribe the rigid gas permeable lenses in this case. And also rose K lenses are there for mild to moderate keratoconus. What are intact? These are the corneal rings. इनको कॉर्निया के पेरिफ्री में लगा देते हैं तो सेंटर ऑफ कॉर्निया को फ्लैट कर देता है. एंड कॉर्नियल कोलेजन क्रॉस लिंकिंग विद राइबोफ्लेविन is done after, followed by UV ray exposure. It will decrease the progression of keratoconus. Then keratoplasty can be done, which is anterior lamellar or penetrating keratoplasty can be done. Now what are the other ectatic disorders? Keratoglobus. In keratoglobus, whole cornea will protrude. Hemispherical protrusion will occur. Whole corneal thinning is there. It is a non-progressive condition, familial or hereditary. And what are the DD of it is congenital glaucoma, जिसमें cornea का size भी increase होता है, IOP भी increase होता है, and you will also see the optic disc changes in congenital glaucoma. In that way you will differentiate it from keratoglobus. Others are keratoconus posterior, which is a very rare condition and it is non-progressive. Others are PMD and TMD, that is pellucid marginal degeneration, Terrien's marginal degeneration. Teres ऊपर होता है ना, तो Terrien's marginal degeneration ऊपर से cornea degenerate हो जाएगी, and pellucid marginal degeneration नीचे से cornea degenerate हो जाएगी. एंड देन केराटोकोनस को आप ऐसे रिमेंबर कर सकते हैं बाई केराटोकोनस के से केराटोमेट्रिक वैल्यूज आर इंक्रीज्ड. ई फॉर एक्टेटिक डिसऑर्डर, आईलिड में यू विल सी मुनसॉन साइन which is a V-shaped deformity, so by V you will remember Vogt striae. Then by R, refractive changes like myopia, astigmatism. T for corneal basically thinning, which will result in high drops, oil globule reflex and scissoring reflex. Oil droplet cataract I have already told you. So thank you for your patient listening.